Okay guys, I'm going to go over some of the models that we have in laboratory that deal with the male reproductive system. This first one here, I just call it the 3D board, and it's a relief model showing the male reproductive system. Let me get my pointer here. So what we see is up above we have a spermatozoan, and we'll talk about those parts in a minute. And then down below we have a sagittal section cut through the male pelvis. Just to get you oriented a little bit, this is the rectum back here. It's posterior, and there's the penis in the anterior. This is the scrotal sac with the testes inside it here. This white structure number 34 would be the pubic bone, and then this would be the abdominal cavity, and then the pelvis down here. Okay, so I'll move on to these models, and I have a little list next to the models to remind me of a few things to point out. So this is that same model, and in it we're going to take a look here down at the external genitalia. So this is the scrotal sac, and within there we can see the testis, number 1, and number 2 would be the epididymis with the head, body, and tail. Connected to that is a vas deferens, passes up into the anterior, passes through the anterior body wall into the abdomen. This would be the inguinal canal, where the spermatic cord and the vas deferens passes into the body. And there's a superficial inguinal ring here and a deep inguinal ring there. When a physician is feeling to the lateral side of the testes and they have you cough, have a male cough, they're looking for a bulging of the peritoneum out through this external inguinal ring as a sign of a tearing in there, which would be an inguinal hernia. So the vas deferens passes over the urinary bladder, and at this point joins the seminiferous, not seminiferous, seminal vesicles or seminal gland. And number 6 here would indicate the ejaculatory duct, where during emission the sperm are mobilized up to this area. And that passes through the body of the prostate gland right there, which sits immediately inferior to the urinary bladder. The internal urethral sphincter would be right there in the wall of the bladder muscle. And I think maybe in lab I misspoke. I told you this was called, well, I don't want to say it again, but the urinary bladder wall muscle is called the detrusor muscle, and I hope I didn't misspeak. I'll explain why that might have been confusing. So that's called the detrusor muscle. Kind of in the body of the detrusor muscle is a separate muscle, and that's the internal urethral sphincter. Down here, where the urethra passes through the urogenital diaphragm, the musculature of the pelvic wall, that's the external urethral sphincter. So they flank either side of the prostate. The urethra, which drains the urine from the bladder to the external urethral orifice here outside the body, has 3 distinct parts. They have the prostatic urethra, which passes through the prostate gland, where the urethra actually passes through the wall of the abdomen. That's called the urogenital diaphragm there. When it passes through that, it's called the membranous urethra. And then when it gets into this material down here, it's called the spongy urethra, because the erectile tissue around that is called the corpora spongiosum. Something we didn't talk about when we talked about the digestive system, just because I didn't want to get this model out, but back here in the rectum, we can see that there are these, I don't know, kind of shallow depressions in the rectal wall. Those are actually called rectal valves that help hold feces in and let gas escape, flatus escape. And then here we have an internal and external anal sphincter. The internal anal sphincter is under parasympathetic control, and the external anal sphincter is under skeletal muscle. That's under voluntary control. Oh, what else can we point out here? Well, the erectile tissues, we know, are the corpora spongiosum, which when that becomes engorged helps keep the urethra open so that ejaculation can allow the semen to pass through. And then there's 1 corpora spongiosum, and dorsal to that are 2 corpora cavernosa. So it's kind of a triangular arrangement. These are a little lateral, and on the dorsal surface there are 2 of these. The corpora cavernosa are the larger erectile tissues that actually stiffen the penis during an erection and during intercourse. We can see down here is a collection, kind of a messy collection of blood vessels. Sorry, I'm drifting off to the side here. A collection of blood vessels, testicular arteries, and veins. These would actually surround the vas deferens along with the muscular layer and a fascia that would together make up the spermatic cord, and I have a better picture of that later on. Okay, I think that's the outer white fibrous structure that we see on the outside of the testes is called the tunica albuginea. Okay. Here's a close-up view of the spermatozoa, which we know are produced in the seminiferous tubules. This is the head of the sperm here, and its enzyme-containing tip is called the acrosome. Behind that, we have what's called the midpiece, and the midpiece is loaded full of mitochondria, which take in the fructose from the seminal fluid and generate ATP. And at the base of that, we have the tail, or the flagella. Really, that's about all you want to know about the sperm. Well, other than the fact that the haploid nucleus is housed up here in the head, and the acrosome contains the digestive enzymes like hyaluronidase and some proteins that are involved in a specific receptor interaction with the egg during fertilization. Here's another male 3D pelvis. This is a kind of a more 3D model than is the board. And we can see many of the same structures we could see in the board in here, and I'm not going to reiterate all of those again, but I'm going to try to point to a few that are maybe more readily apparent in here. One of them is the seminal gland, or the seminal vesicle. Here we can see the vas deferens passing laterally and posteriorly to the bladder. That yellow pouch there is the seminal vesicle, which would lead into the ejaculatory duct, which would then go into the body of the prostate, seen here. It's worth pointing out here, you can see why in males, when they have to have an examination of their prostate, it's done by a digital rectal exam where a physician inserts their fingers into the rectum, and then they can actually palpate the prostate through the thin wall of the rectum to see if it's enlarged or hardened or anything like that. And usually males after 40 have to have that checked. We can see in this one the penis hasn't been cut in half to show you the internal structures. So here we can see the external structures. Most notably would be the head of the penis down here, which is covered by the foreskin, which is technically called the prepuce. And there we can see the testes and the epididymis within the scrotal sac connected to the spermatic cord. Okay. Here we've taken away the covering of the penis so we can look inside, and again we can see the corpora spongiosum surrounding the urethra and the corpora cavernosa. The base of the penis has two structures that are continuations of these erectile tissues. There's the rounded bulb of the penis, which is the extension of the corpora spongiosum, and there's the crus. Each corpora cavernosa has a crus that comes in and actually connects to the urogenital diaphragm, and that's what connects the penis to the connective tissues inside the pelvis. We have a nice view of the prostatic urethra here, membranous urethra right there, and then spongy urethra on the way out. The ejaculatory duct, we can just see the end of it extending towards where the seminal vesicles would be. We can very nicely see the urinary bladder here, and we'd have the location of the internal urethral and external urethral sphincters, shown here just kind of colored in or sketched in but not painted differently. That little circle that I'm right on top of there, that's actually the bulbourethral gland. One thing that does show up in this model particularly well is the cutaway of the testes. So we can see back here, this is the epididymis, divided from that from the testes lobules by the septa. And in here would be the lobules of the testes, where the seminiferous tubules would be. The rete testis would be a small network of tubules right in this area that would lead from the seminiferous tubules into the epididymis. And then we can see there's a layer right here, which is actually the tunica vaginalis. And then outside of that, shown in yellow here, that's a muscular layer, and that would be the dartos muscle, which I think I might have mistakenly said in lab the other day was the name of the wall of the bladder. That's the detrusor muscle. The dartos muscle is a muscle that goes around the outside of the testis and can flatten the scrotal sac up against the body wall when it needs to warm it up. Okay, I get everything in the list there? I think I did. Here's an older 3D pelvis, and I like this one because this has the best view of the spermatic cord, which is the structure right here. Now that's the vas deferens continuing on into the abdominal cavity, but once we get out here and go through the inguinal canal, it's called the spermatic cord, and that's where it's joined by the pampiniform plexus, which is actually just a collection of loosely aggregated testicular veins that are taking the blood back up to the body. And then the smaller testicular arteries in red beneath that. If you look closely, you'll see some red streaks traveling down this, kind of painted in there. Those are not arteries. That's supposed to represent the cremaster muscle. There's a skeletal muscle fibrous network running through this spermatocord that actually can raise the testes. When the cremaster muscle contracts, it lifts the testes up and kind of nests them into the anterior body wall. So with the cremaster muscle lifting the testes and the dartos muscle flattening the testes, that's how we thermoregulate the testes. When they're cold, we bring them back up closer to the body wall to warm them up. And when they're warm, both those muscles relax and let the testes fall away from the body wall so they cool down more. I think those are the major things in this model I wanted to point out. Okay, let's get on to the histology. This is a cross-section through the seminiferous tubules, and this is, I believe, up on 400x power to see this level of detail. So we're seeing one tubule here, right around there. That's one tubule. So over here to the right, there's another tubule, and down here to the lower right, there's another tubule. Can't quite see one there. It's just the edge of one there. And over here to the left is another tubule. This area here is actually a blood vessel and interstitial space. The edge of the seminiferous tubule is made out of a special type of epithelium called myoepithelium. It's actually a hybrid epithelial muscle cell. I think some books call them myeloid cells. Myoepithelium. So let's cross over that and go into the tubule itself. Well, we see these type of cells here that are kind of dark and somewhat large. And they're right on the edge. Those cells here, there, these guys, right, there's one right there. Those are what are called Spermatogonia. Those are the cells that are going to divide one of two ways. They're going to divide by mitosis to regenerate themselves for future generations of division, or they're going to divide by meiosis, in which case they're going to divide and they're going to migrate this direction, and they're eventually going to become spermatids here in the lumen. So spermatogonia are constantly being replenished within the tubule so we don't run out of them. The somewhat indistinct cells in here, but they're kind of scattered around in the wall. All of these cells in here, there. Those are all spermatocytes. They're a mixture of primary and secondary spermatocytes. And on this power, in this type of stain, we can't tell the difference between the two. Spermatocytes are the cells that are dividing by meiosis. So, roughly speaking, closer here to the basal compartment, you'd have primary spermatocytes, and down here we'd expect to have more secondary spermatocytes. But like I said, they're kind of mixed in, so you can't really tell. So we'll just say most of these cells in here are spermatocytes. The round ones certainly are. When we finish meiosis, we become a spermatid, and that's what all these tiny little dots in here are. This slide isn't stained very darkly. In some slides they look almost like little black commas, and you can see there's a couple right there. Those are spermatids. They're going through the process now of spermiogenesis. So meiosis generates a spermatid, which is not a sperm cell. It's a non-motile, non-functional gamete. It has to go through spermiogenesis, where it diminishes the cytoplasm, it grows the acrosome, it gets the midpiece and tail structure, and that all happens over an ensuing almost a month. It starts here in the lumen of the seminiferous tubule, and then it continues as this material is pushed through the efferent ductules and the rete testis into the epididymis, and there it'll continue maturing for 20 to 40 more days, where it'll finally become a functional, mature spermatozoa within the tail of the epididymis. So in here you see some spermatozoa that are in the process of forming. That's why they have those swirly little tails in there. One more cell type to mention, and it's a little hard to make out, but you can kind of see this gray background that's almost on a column that I'm tracing right there, and here as well. There's another spot. They don't really have that round shape that we expect the spermatocytes to have. It's just kind of this streaky column, and every once in a while you can see there's a nucleus of one right there. This cell that I'm tracing, that's in here, I'm going to trace the length of one right there. Okay, that type of cell that I'm tracing there is a Sertoli cell, or a nurse cell. Here we can see kind of the body of one. That's a nurse cell. So these cells have 4 different names that I've heard them called. Sertoli cell is my favorite because it's short. They're also called sustentacular cells, or sustenocytes, or Sertoli cells, or nurse cells. They're all the same thing. These are the guys that are prompting the Spermatogonia and the spermatocytes to divide by meiosis, by producing androgens that guide the process, and actually by cell-to-cell signaling with cytokines. The Sertoli cells are responsible for pushing the cells to continue through meiosis. And if the cells fail to go through meiosis, the Sertoli cells will actually phagocytize them, take them in and break them down. That's one job that the Sertoli cells have, and they do that in response to testosterone signaling. The testosterone is actually coming from outside the tubule in these cells out here. To the left I'm showing them. Those are called Leydig cells or interstitial cells, and they're outside the tubule, and they are actually what are manufacturing testosterone in response to signaling from the pituitary by luteinizing hormone. Luteinizing hormone from the anterior pituitary causes the Leydig cells, the interstitial cells, to generate testosterone. The testosterone makes their way into the tubule and triggers the Sertoli cells to prompt meiosis, which is the beginning step in spermatogenesis. The other job that the Sertoli cells have, and the reason that they're long like that, is that they actually kind of flare out right here in this region, and they touch one another. And we don't really see that in the slide so much, but they come out and one touches a neighboring one, and they form a barrier. They have a tight junction there, which is like a desmosome and a zonula occludens, and that tight junction forms what's called the blood-testis barrier. And it divides the seminiferous tubule into two compartments, a basal compartment here, where you have the Spermatogonia, and an adluminal compartment, which just means close to the lumen, out here, where the spermatids form. And that's important because during negative thymic selection in embryonic development, we had no spermatids. So that means that our immune system didn't learn to suppress those types of lymphocytes that would recognize that. So we can't have our lymphocytes and our antigen-presenting cells getting into here, picking up bits of spermatids and stimulating our adaptive immune response, or we'll create antibodies that would come in here and actually destroy our sperm cells. So that blood-testis barrier prevents the immune cells from gaining access to the luminal compartment where we could activate our adaptive immune response. So the Sertoli cells create the blood-testis barrier. Okay. I think that covers most of everything I need to tell you about that. I have another picture, the next one. This is just another picture that has a little bit better contrast. So in this one, we see some arterioles out here in the interstitial space, and we can see, let's see here, there. Those are interstitial cells. If you look closely in a microscope, you'll see that they have some lipid inclusion bodies that are used to actually synthesize the testosterone. Then we have the myoepithelial cells here that make the wall of the tubule. And you come inside of that, and these little guys, those are actually the Spermatogonia. Okay, there. And then these represent spermatocytes that have started dividing. Okay, and then this kind of amorphous gray material that we see in there, that's the cytoplasm of Sertoli cells. In this particular one, we don't really see any spermatozoa within the tubule, not many. Nor do we see the dark spermatid heads, just because it's not stained that darkly. Here you can see a few. These are spermatids down here in a different tubule. Okay. And I believe that is all I have. There are a few other histology slides, and I don't know how much time Dr. Rex will have, or if you guys will be ahead or behind. But there are a few other slides, and the ones that I've put in this list here, the prostate gland, the seminiferous tubules, the spermatochord with the vas deferens, and the epididymis, are all ones that I would ask you to look at as potential bonus. And really, it's just a matter of recognizing the tissue. Within the spermatochord, you're going to see blood vessels, you're going to see fat, you're going to see connective tissue. The one thing that I'd like you to be able to pick out in there is the largest obvious structure inside there, which is a muscular tube, and that's the vas deferens. So if you do look at the spermatochord, make sure you can identify the vas deferens in there. The epididymis, we have a testis slide that says, I believe it says testis with epididymis. If you look at that one, try to find the dense regular CT layer that separates the seminiferous tubules from the epididymis. And you can see how the tubes look a little different. That'd be about the only thing I would point out in that slide. All right, guys, that ends my male reproductive models overview. I hope that helps a little bit without bogging you down too much. Okay, good luck, and I'll see you next week.